Next, we are welcoming Frank Hester, who is the founder and CEO of the Phoenix Partnership. Now, Frank has represented the UK health industry on numerous government trade missions around the world. He was awarded an OB, I beg your pardon, for his services to healthcare, and will be sharing his thoughts on maximising our digital infrastructure for a 21st century workforce. Would you please give a very warm welcome to Frank Hester, OBE.
Thank you very much. I think that made me sound really good. Well, my name is Frank. I'm delighted to be back here on the Intelligent Health stage. I enjoyed a conference like this in Basel, and it was very helpful. And I'm already enjoying meeting some of you today. And I'm already learning stuff right here. So thank you. And it's great to be here in London and focusing on the NHS. I'm from the UK, and we all love our NHS a little bit, and it certainly hits me to the core. What I want to talk to you about today is how technology can allow clinicians to care better for their patients. This was kind of my vision when I started out doing this 21, 22 years ago. My wife at that time was a doctor, and I'd seen how long she'd studied to be a doctor. And I think she had 3 degrees. And I used to go and pick her up after work, because we only had one car, and I'd pick up the kids and then go and pick her up, and she was always working late. And she was just spending a whole load of time on administration rather than what I would call being a doctor. Scheduling patients in and out of social care or booking them into hospitals, and that kind of inspired me. And I really liked Tara talking earlier on about helping doctors save time, and I think that's something that I really want to talk about today, and how we can help our NHS. There's a lot of excitement about AI. I'm a computer programmer. I work on AI. I love it. It's fantastic. It's our new toy, and we're getting fantastic results out of it. But I don't want us to just see AI as some sort of panacea for everything. I want to reference some other stuff that I also think makes a real difference. And I think it's combining a number of factors together. And I think unless we put the AI right into our healthcare system properly, it won't be fulfilled. And I do see it as a key part of that, and I'm going to reference this later on, interoperability. And very especially getting that primary care record into hospitals. And I see that as a key thing. And I think that will help us realize the AI around our infrastructure. And as with all technology, you know, I can get very interested and very excited working in my office or working at home about the potential, but it's got to be real world. It's got to fit with the doctors and nurses and the pharmacists and our clinicians right across our infrastructure, and it's got to make a difference to them. So, I've got a clicker here. Yay, right. Traveling salesman problem. How do you, I think we've got about, I think there's about 300 dots there, and about what's the best way of going to all those different places? It's a problem that's 1832. It's an age-old problem. It's mathematically interesting to me. As far as I know, there is no proven mathematical solution for this. But pragmatically, we do have solutions that kind of work. It's tricky, working out the travel distance, time of day, the traffic, thinking about breaks and working hours, and restrictions on arrival times at each point. And then, and it's that's just potentially one salesman. But imagine trying to do that for hundreds and hundreds of people and scheduling that. And I think, yeah. So here's a computer working out the solution, and it happens to be like that, and that's the way around. And that's a fairly sort of simple problem for a computer to solve. And I think everybody can get that computers are kind of good at that kind of thing. Even if the algorithm isn't very good, it can just run the algorithm again and again and again and try and get a better solution. Why is that interesting for healthcare? Well, we plan work for our community nurses going out every day to visit patients. And it's a little bit more complicated than the traveling salesman problem, because we've got, what equipment do you need to take with you? What's the skill set of the nurse who's going out? Do you need multiple members of staff at each visit? Who's on holiday this week? Who's off sick? Yeah. Mrs. Smith needs a medication before 9 a.m. And how do you plan all that? And that's the problem that's going on right across the NHS at the moment. And we've had a remarkable and lovely experience last year watching Leicestershire dealing with this. They've got about 30 teams, and they've kind of planned this using a computer algorithm to solve it, and the stats are phenomenal. I don't know which one I prefer. I really like the patients on the waiting list. They used to have 76 patients on their waiting list. So that's 76 patients who weren't being cared for, who weren't getting the right medical treatment, and now they're down to 0. I also like the stat on the bottom left. They've gone from 31% of their time in front of patients to 71% of their time in front of patients. That's nurses who are spending more time driving than actually looking after patients. We put them through all that training. They want to be in front of patients. That's what they do best. And I think that's a marvelous stat. Also results in more training time for the nurses, and a reduction in staff vacancies. So we're looking at, and this is our NHS, we're looking at getting better qualified nurses spending more time with patients. And I think this is a fantastic example of how IT can help. And this isn't AI. This is just a computer doing something a bit smart. It's not supplier specific. This isn't a hard algorithm to kind of bang in. It's a straightforward one. And I would encourage you from my heart to try and get this sort of stuff across the NHS, because I think it makes a fantastic difference. And that's Leicestershire. That's, I think, 30 teams, about 300 people. But oh, sorry, I forgot this bit. This bit's really good. This is what the doctors and nurses are saying. Great potential, saves so much time. And why am I showing you this? This is actually sort of Twitter from last week. This is what the doctors and nurses are saying about this particular thing. And I think it's key with any IT that it's got to get to our clinicians. It's got to get out there. It's got to hit them, and it's got to make a difference. And I'm delighted to show an example of this. And, pretty much anybody, the traveling salesman algorithm from the 1830s, it's not that hard. You can pick it up off the internet, bang it into your software solution, and make a real difference. And then imagine that scaling up. We're looking at 300 staff in Leicestershire, scale that up across the country, making a real difference to our NHS, giving clinicians back some time, and that's the major problem that we've got. A growing need, and not enough doctors, nurses, pharmacists, etc., to meet that need. So I do think a key thing is, I get easily excited as a computer programmer about the next technology, about the next thing that's going on, but it's getting that into the doctors and nurses' hands and getting it in the right place and then saying, is it making a difference? But I just think that's a super example of something making a difference. And it's not even AI. We're not even getting to the sexy bit yet. What have I got next? Yeah. I think I quite like this one. If a machine can behave in ways that would be called intelligent if a human was so behaving. And okay, that's not using, I like deep neural networks, I'm intrigued by the random forest algorithms for AI, but it can just be some straightforward stuff, and I think we've got a lot of possibility for change, not just in the NHS, but across the world with these kind of things. Where am I now? All right. I'm coming on to AI. So UCLH done some fantastic work in identifying patients who've missed their appointments. I mean, these figures are startling. £1 billion for missed appointments. And I really like the stuff that UCLH have done with that. The company I work at, we've done some similar stuff in primary care for GPs, and we're able to kind of predict with quite some success who's gonna not turn up. And in primary care, we're talking about £216 million a year wasted. And then, and there's some obvious things that you think, well, what can we do about this? Well, a GP could easily tend to double book appointments for those who aren't turning up, or you might want to, in a hospital, send some automatic text messages to remind patients to come in. But I think the more intriguing thing that I would put to the room is then once we've got these patients who don't turn up, I think there's an interesting bit of research to be done on why they're not turning up. Is it because they haven't got the right support? Is it because they're elderly? Is it because they're just forgetful? And I think that's an intriguing piece of work that we haven't touched on yet, and I would invite people in the room to kind of think about that problem. But I think knowing who it is a great step forward. Oh, yeah, right. Oh, this is pretty funny. So this is Matt Hancock, who happens to be our health minister. And I quite like this. I mean, this speech the other week, giving clinicians back the gift of time. And that's essentially really what I'm trying to talk about. I think Hancock may have sneaked into my office and looked at my slides, or it's just that we've got a synergy at this moment. And I do think, and I've felt really for 22 years, that's the most important thing that I, in the world of technology, can do for a doctor, is to try and give them back that time, take away the workload and let them focus more on the thing that they're really good at, which is seeing patients and helping. Right. This is another one that I absolutely love. Merely, medicine's reconciliation when a patient arrives in a hospital is an arduous task. It can take up to an hour, but we can get it down to minutes by simply having the primary care record feed in, and we're seeing this happen. And I think we're going to be able to see this happening right around the country, really, by the end of the year because of interoperability. And this is something I kind of referenced earlier on, that you really, really need that primary care record interoperating with secondary care. It's absolutely essential. But that's basically every single medicine's reconciliation, getting it down to a couple of minutes. And a similar story with pre-op assessments we're seeing as well. Down from, I think, 45 minutes down to about 5 minutes. Not AI, not that sexy, just interoperability. But making a real difference and giving our doctors back the time. This is a job that doctors do. And really, 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 we should be banging the IT in there and encourage every supplier to be doing this, getting that primary care record into secondary care and cutting down. They're two straightforward tasks. The other advantages of interoperability, the doctor can see what other doctors thought, can see what other doctors diagnosed. You can kind of see how many doctors the patient's seen before they've seen you. Absolutely gold dust. And I know from my 22 years of experience that occasionally it saves a life too. And again, another use of IT that's really giving time back to the doctors. Oh yeah, okay, so the graph is just showing us that we're getting a few less GPs now. We're a bit short on GPs. And I do think here that I've been working on the AI stuff for about 2 years now, and working on ovarian cancer, prostate cancer, bowel cancer, and lung cancer, and we're getting really, really positive results. And we can kind of be as good as the GP about 50% of the time, and the other percentage we spot it before the GP spotting it, and it's nice and it's saving lives. But what it also gives us is the opportunity to put that into other people's hands, into the hands of the nurse or the pharmacist. And it's a tool that can sit beside them and help them. For example, spot ovarian cancer. And I think it's always worth saying at this point, I'm not thinking replacement, I'm thinking enhancing, I'm thinking augmenting, yeah? I spend a lot of time going around the world, and I think if there's one thing that is the same around every country in the world, nobody ever says to me, Frank, it's not a problem here, we've got too many doctors, we've got too many nurses. Every country suffers from a lack of doctors, a lack of nurses, a lack of clinicians, a lack of healthcare, because it's a waterfall. The more you've got, the more you want. And I do think that AI can help with some of that stuff, allowing us to upskill and enhance what people can do. And, well, perhaps not so relevant to the NHS, but you can see how in some countries where they really, really don't have a doctor, where it's just the wise woman in the village, where AI can make a really helpful difference there. Oh yeah, right. I'm nearly at the end now, so this is pretty good. Yeah, my kind of quote, you can figure out who's got the better. I think this quote's quite good. Machines will not replace physicians, but physicians using AI will soon replace those not using it. I think that's quite smart. My quote about AI is more like, it's just like a spelling checker. I don't go to bed at night worrying that the spelling checker's going to take over my life or is going to replace me. I get that it's just for checking my spelling. It helps me, and I make less mistakes, but it isn't going to take over. And what's surprised and excited me, because we're rolling out the ovarian cancer at the moment, I thought I'd get a lot more kickback from doctors. The average GP in their lifetime will see, over a 40-year career, see about 4 or 5 cases of ovarian cancer. It's tricky to spot. They've got about 8 minutes to spot it. I wouldn't like to be playing that game. I wouldn't bet on my chances of being able to do it. And what I've found from chatting to the doctors is they're quite happy to have something sitting beside them, giving them a nudge, saying, do you think it's ovarian cancer? Or that one looks like bowel cancer. So I think it's a hell of a tough job that we're presenting to our clinicians and our nurses. And it's only getting tougher. And I think anything that we can do in the IT world to help them is valid. And let's do more. And I think that's it. Yeah, thank you.
Frank, thank you very much. And I know you have spoken a lot about interoperability today, but we just wondered what your view is on AI over the next 5 years, and if you can give us an insight into that, please.
Right. And we're starting to do this now, but the patient's going to have their medical record on their app, yeah? And that's going to happen pretty much across the UK this year. And then before any encounter with any clinician, the patient should be typing their symptoms in on the app. The AI will be running on that, will be diagnosing, will be asking, replicating the questions of the clinician. So basically, nobody should be arriving in a GP surgery without already having a sort of pre-diagnosis from the AI. Or the AI might say, just, no, don't go to the GP, get to A&E. You know, you're heading to the wrong place. And similarly with A&E, you know, if you are conscious, you know, get those symptoms in. And at any touch point with any doctor, they should pre-know. And that's where I think we're quite obviously heading, I suppose.
Okay, great. I'll just throw it open to the floor. Are there any questions, ladies and gentlemen, for Frank? You can put your hands up. We've got a couple of minutes. I think we might be able to squeeze one in. I can't see any at the moment.
Hooray.
No? I think you've stunned us all. Oh, there is one. One gentleman here, please. We get the mic. Thank you.
Hi. So in the wake of WannaCry, how do you think the best way to leverage the opportunities that better IT and AI afford us without rendering our system too reliant on it if the worst should happen?
Yeah, the WannaCry. I mean, the WannaCry stuff was bad, yeah? But we were running on software that was like 10 years old. You know, it was an accident waiting to happen. I think I used to work in a bank, yeah? And despite what you see in the movies or in Ocean's 11 or whatever, nobody ever managed to hack into the bank. As a computer programmer, it was something that we talked about. How would you hack in if you wanted to hack in? And we never managed to hack in because the first thing we made sure was that nobody could hack in and steal your money. And that would be the main target if I was a hacker, would be to hack into a bank and get some money. And the patient record will be second, you know. But it doesn't happen because the banks make damn sure you can't hack into the bank and get the money. And I think the answer to your question, sir, is we've just got to take it seriously. It's got to be the first thing that we think about. That patient record is sacrosanct. You know, it's nearly as important as money. You get my point, you know. You know, I don't want anybody hacking into my patient record, and we've just got to take it seriously, I think is the answer, and make sure we're up to date. And but you're right to raise the question. Thank you.
Okay, we'll leave it there. Ladies and gentlemen, please give a very warm round of applause to Frank. Thank you very much, Frank. Thank you.
Thank you very much.
Thank you.